Good day and welcome to this Huntington Learning Center webinar, Is This ADHD or Not? A Parent's Guide to Finding Real Answers. And we're very honored to have Dr. Mary Rooney with us today for this presentation. I'm Michael Hackmer. I'll be your moderator for today's event. On behalf of everyone at Huntington Learning Center and Dr. Rooney, I want to say thank you so much for joining us with this event. We know there's a lot going on, so we really do appreciate you making the time to be with us. If you've attended webinars with us in the past, you will know that we use GoToWebinar. And as you can see on your screen, there'll either be a box or there'll be a little bar that you can click on to expand on your screen. And that's where you would submit your questions, whether it's questions for our panelists or if you want to engage in chat with me because you're having a technical problem or there's something else. So we do try to get all of our questions in during the course of the event, and then we'll do the Q&A at the end. So I encourage you, if a question pops into your head, don't wait until the actual Q&A session because you may forget. So let's get all the questions in as we go through the presentation. Now, if for whatever reason we don't get to your specific question during the course of the webinar, we do capture all of them, and so someone can follow up with you after the event. Sometimes questions are very technical, and we want to make sure that we provide a very thoughtful and detailed answer. We're also recording this webinar, so this will be made available on demand, and you can get it on huntingtonhelps.com, which is the Huntington Learning Center website. We typically send an email about a day or two after the event with the on-demand link. If for whatever reason, though, you don't see that link in your inbox after a couple of days, you can just go to the website under resources, and that's where all of our webinars are located, including our other on-demand events as well as our upcoming events. So a little bit about Huntington Learning Center before we dive into all of our great content. So Huntington has actually been around for nearly 50 years, and Huntington's a leading tutoring and test prep organization, as many of you know, serving students in grades K through 12. Now, I think that there are really three great differentiators, things that really separate Huntington from other tutoring and test prep organizations or going out and just hiring a kid who maybe graduated, high school or college recently to help tutor your student. And here they are. So first and foremost, all of our programs are taught by highly trained and certified tutors, right? And that's really important. We actually have an award-winning tutoring and test prep team. And it's really critical that everybody who interfaces with your child or your student learner has that kind of training and that skill. Second, Huntington is accredited by Middle States Association of Colleges and Schools. And that's really important to us for the very specific reason that as your child goes through their academic journey, most degree or certification or schools that issue degrees or certifications are going to be accredited by Middle States. And so that's really important for us to maintain that level of accreditation. And third, and I think this is probably, one of the best differentiators, is our personalized and very targeted approach that we have at Huntington. So we get students in, we do an assessment, we really want to try to understand the strengths and weaknesses, because a lot of students will come in and say, hey, I've got problems in math, or I've got problems in test taking, but at the end of the day, the challenges and things that you have are going to be, your student learner is going to have, are going to be unique to them. And we want to make sure that we identify what those strengths and weaknesses are so that we can really work with them, and the results really do speak for themselves. And typically in just about 3 months, Huntington students see a total average increase of 2.2 grade levels in reading and in math. And that's pretty significant. And then of course, when we get into our SAT and ACT prep, which is something that Huntington is very well known for all across the country, you're looking at an average increase of about 229 points in the SAT, which again is very significant, and 5.4 points on the ACT. And then of course, a lot of stuff that we do in terms of improving academics translates into scholarships, and that's really beneficial too when you consider the cost of college and private schools. So we'll talk a little bit about the foundational programs that Huntington has. So our foundational programs are our Learning Center and exam prep programs. And we talked a little bit about that a few moments ago in sort of a broader context, right? Our Learning Center program is an academic skill-based program. It's customized, again, like all things that we do at Huntington, really customized to try to meet the students' academic needs. K through 12 tutoring in phonics, reading, spelling, math, science, and study skills, right? And then of course, our ADHD program, which is part of the topic that we have here tonight, right? ADHD. So, and then of course our test prep program, which we do across not just for college entrance exams, but also for AP or advanced placement exams, state standardized tests, and so forth. So we have really great programs, and we try to be, as accommodating as we can for all of our student learners. And then of course the academic evaluation, which I spoke about earlier at the start, as a way that we really help differentiate ourselves and really getting through to understanding what those strengths and weaknesses are and pinpoint the exact gaps that your student learner is experiencing. And so the academic evaluation really allows parents to stop guessing and get the answers needed to take action to really help your child achieve their full academic potential, right? And so it's a good idea to see kind of where your child is performing. You know, the nation's 4th and 8th graders, once again, posted underwhelming performance on the National Assessment of Educational Progress, which some of you may be aware of, right? And so really want to make sure that we understand where your child is in their academic standing and develop that plan so that we have a good roadmap to build upon their success going forward. So now it is my pleasure to introduce Dr. Rooney. Now, Dr. Rooney, for those of you who've attended webinars with us in the past, has been a very frequent speaker talking about ADHD as well as other topics. She's a licensed clinical psychologist, board certified in child and adolescent psychology, nationally recognized ADHD expert. In fact, she contributes significant content to the Huntington Learning Center blog. We have a whole ADHD section of content in which you can see a lot of Dr. Rooney's content, as well as on her personal or professional website as well. And she really works closely with parents and teachers, and this is one of the great things about her, because it's really important to create that supportive, structured home and school environment, because that's going to enable children and adolescents to really reach their full potential. So we really appreciate Dr. Rooney's partnership and her knowledge. And without further ado, I'm going to turn things over to you, Dr. Rooney.
Wonderful. Thank you so much, Michael. Welcome, everyone, and thank you for being here tonight. We're going to be talking about a question that many parents quietly ask themselves, which is this ADHD that I'm seeing in my child, or is this something else? And our goal is not to rush to an answer to this question, but to help you think clearly and confidently about the next steps that you can take. This presentation, I just like to remind everyone, is educational and not a substitute for individualized medical advice. Every child's different, and I encourage you to listen for patterns that resonate with your child's experience and your experience of your child. So here's our roadmap for today. First, we'll clarify what ADHD actually is, and then we'll explore conditions that can look like ADHD or mimic ADHD. And then we'll talk about ADHD evaluation, the components of that, and what you can do now while you're maybe waiting for an evaluation or still thinking about next steps, and then when to think about seeking help. Great. So does any of this sound familiar to you? Parents often notice inconsistencies in their child, some of which may point to ADHD, or some of which may make them think, no, maybe it's not ADHD, and it's kind of swing back and forth on any given day or on any given week or month or school year. So things often come up like, my child can focus on video games for hours. They must not have ADHD. Or, my teacher says my child is distracted, but I'm not necessarily seeing that at home. Or, well, don't all boys have this much energy? Or is it just my child? Or, is this what they're seeing at school, too much energy? Or they just have unrealistic expectations about how long a child or a boy should be able to sit all day or all afternoon? Or, gosh, homework just takes forever. Is everybody struggling this much at home with homework, or is it just us? And then, is this ADHD or is this something else? So what is ADHD exactly, right? So ADHD is a neurodevelopmental condition, meaning it involves how the brain develops and regulates attention and behavior. It's not about intelligence at all. It's not correlated with intelligence. It's two completely separate things. And it's not about effort either. Many kids with ADHD work extremely hard to do what they do and get through their days, even if it doesn't match the same level of productivity that you might see from a kid without ADHD, or a kid with ADHD who's getting supports. It's about regulation, really. ADHD is more a disorder of regulation than it is a disorder of attention. So it's about being able to regulate your attention. And that's why we see some kids able to hyper-focus on certain things like video games, or something that might be something they're highly interested in. Some kids can hyper-focus on reading. Some kids hyper-focus on Pokemon. Some kids hyper-focus on sports, all kinds of things, but then not be able to focus when they need to if it's something less interesting. So it's about being able to regulate that attention, regulate your emotions, regulate your activity level, regulate your impulses or your impulse control. ADHD symptoms always begin during childhood. It's actually a requirement of the diagnosis that they start during childhood. Most of the time, they continue into adulthood. So research shows us that at least 80% of the time, people will still meet diagnostic criteria in adulthood for ADHD. And then that other 20% that don't, most of them will still at least have some symptoms that may or may not be causing problems for them in adulthood. But the way that ADHD symptoms show up for any one individual, or how much difficulty they cause in a person's life, will change over time, over the course of their lifetime. And we'll talk more about this later. ADHD is largely genetic. It's genetically based, so it's highly hereditary. The way I like to talk about it is that it's about as hereditary as height. So while we know that just because of parents' height doesn't mean that your child is going to be exactly the same height as their mother or as their father, but it's a good kind of metric for if you're likely to have a child that's going to be tall or not tall, or shorter, or kind of in the middle, right? So there's a genetic factor. It's just not a one-to-one. ADHD symptoms, in terms of their presentation, they fall into 3 different symptom clusters, right? So there's the inattentive or inattention cluster, hyperactivity cluster, and impulsivity cluster. And kids can have symptoms in one or all 3 of these clusters. When kids have symptoms in the inattention cluster, or they're primarily in the inattention cluster, that's where most of them fall, then we'll say that they have the inattentive subtype of ADHD. Some people refer to that as just ADD, because it doesn't have the hyperactivity piece in there. But when you hear psychologists, psychiatrists, doctors talk about it, they always say ADHD for all of the types. They'll just say the inattentive subtype of that. Some kids will have only hyperactivity, or a combination of hyperactivity and impulsivity, and we call that the hyperactive impulsive subtype. And some kids will be combined type. That's when they have symptoms from all the different clusters. So the inattention domain includes not just trouble paying attention, but also difficulty with organizing, difficulty remembering things or losing things, and making things that are called careless mistakes, where it looks like they're being careless with their work by making careless errors on math, for example. With the hyperactivity and impulsivity clusters, we'll talk about those two kind of together. It's things like fidgeting and squirming, getting out of their seat at times when they're supposed to stay seated, like maybe at dinner or at school, running or climbing on things excessively when they're younger, difficulty playing quietly. It also includes things like talking excessively or blurting out answers, interrupting, and difficulty taking turns. So from a more practical perspective, or like as psychologists will talk about this as in terms of impairment, like how do these symptoms show up during a child's day-to-day life and cause problems for them, rather than just talking about the specific symptoms. So these are the kinds of struggles that kids with ADHD will have, right? So they'll have a hard time following multi-step instructions, managing their emotions and frustrations, completing work on time, transitioning between activities. That's a big one, trying to get out of the house, or at school, transitioning from one activity to another, or stopping what they're doing when they're asked, rather than kind of just continuing to go on and on. Staying seated or focused, staying organized and keeping track of things, following rules, getting out of the house on time, difficulty in social situations, or difficulty making friends or keeping friends, or having sort of stable, non-explosive friendships, And then executive functioning, is a term that you'll hear a lot. A lot of the ADHD symptoms overlap with executive functioning problems. And a lot of these impairments that you see here overlap with executive functioning problems. I'm not going to go into too much detail about executive functioning today, but it's something that you may come across and see as you're learning about ADHD because of the overlap. So ADHD looks different over time. And this is what I was mentioning before, that the symptoms kind of shift with development. So when kids are young, you're going to see those hyperactive and impulsive symptoms more prominently. So, these are kids when they're little, they have a really hard time sitting still. They may run off when you're walking down the sidewalk with them and you feel like you always have to hold on tightly to their hand, or maybe you're kind of nervous about kind of going out on your own with them when they're so little because they're a lot to manage, right? But at that age, you don't see as many symptoms of inattention, right? You might not say, oh, my child has a really hard time focusing, when they're 3 or 4. You're more focused on the difficulty they have sitting still. Or you wouldn't necessarily think of a 4-year-old as having trouble keeping their things organized, right? Because at that age, parents do that for them. The expectations are really low around that. And most kids would have a hard time staying organized when they're 4 years old, right? So those inattentive cluster symptoms aren't as prominent or as noticeable. And then over time, and I should also say, for some kids that don't have symptoms of hyperactivity and impulsivity, when they're 4 years old or 5 years old or 3 years old, you're not going to see hyperactivity and impulsivity in them necessarily because they're the inattentive type. But for kids that do have that hyperactivity and impulsivity when they're younger, that's when it's most noticeable. But over time, as they're getting further along in elementary school, certainly into middle school, into high school, that hyperactivity and impulsivity naturally decreases over time, right? So you don't see like a high schooler, right, who you're worried you're walking along that they're just going to like run across the street, ahead of you and not stay with you, and you have to hold their hand the whole time, right? That developmentally, that all shifts and decreases. What maintains, though, or becomes more prominent is the difficulties with attention. So getting started on tasks, staying organized, and around the time when demands start to really increase in school, you see this first like uptick around 2nd or 3rd grade when the expectations around how long they're supposed to sit in their seat at school and really focus on a math lesson, right? We'll go maybe from 20 minutes to 30 or 40 minutes or longer. The number of assignments, the length of assignments starts to increase, and then that just continues to increase through middle school and high school. And so the impairment starts to increase as well. And then as you get up into middle school and high school, problems with organization and attention, multi-step instructions and complex projects, all of those things make it even harder and can make ADHD symptoms more impairing. And at the same time, the expectations around doing things independently increase. So what might have been okay for you to think like, oh, my 4th grader, they just need a lot of help staying organized, and I'll help pack their backpack for them. I'll help make sure they're on schedule and on time. By the time you've got a 9th or 10th grader, you're just sort of expecting them to do more of that on their own. And so you're pulling back that support, and their ADHD symptoms are more impairing again. The impulsivity, you may still see some of this as kids get older in middle school and high school, but it shows up more in terms of like making impulsive decisions, or maybe being more likely to engage in some riskier behaviors, or acting impulsively in relationships. So the impulsivity might still be there, but it sort of changes over time. All right, so let's talk about conditions that can mimic ADHD or kind of look like ADHD but aren't ADHD. So not all attention problems are ADHD. An anxious child might look distracted because their brain is preoccupied with worry, or because they're having difficulty sleeping. Sometimes they'll avoid tasks because they're anxious about them, or they're perfectionistic and they feel like they can't do it perfectly and they're afraid to start. And that can look like procrastination or difficulty getting started. Sometimes they become very detail-oriented, and so they're trying to stay organized, but they get caught up in the kind of minutia of things and can't stay organized or create an organizational system that works. So they look disorganized. They can also be restless because of anxiety, very fidgety, excuse me, and that can look like hyperactivity. But the root cause is different. They may be having difficulty sleeping, which can contribute to all of this as well. And when the root cause is different, the treatment is different too. Depression in kids often shows up as irritability and difficulty with emotion regulation, low motivation, fatigue. They can be have difficulty staying focused because of all of those things. So reduced concentration is common along with sleep problems. And without a proper assessment, this can be mistaken for ADHD. Trauma, so chronic stress from trauma affects the brain's regulation systems across the board. So a child who's in kind of a fight or flight mode or has a history of trauma can struggle with attention and emotional regulation. So it's important to consider context when thinking about how the symptoms are showing up. Learning disorders are very commonly conflated with ADHD. They often also occur at the same time as ADHD, so they co-occur at a very high rate. And so obviously if a child doesn't understand the material, they may disengage, become frustrated, avoid assignments. All these things can look like inattention or like they're rushing through things and careless about their work. And it can be really hard because there's also a lot of executive functioning deficits that can go along with many learning disorders to parse out what is ADHD, what is a learning disorder, or what is both, basically. And that's where a very thorough assessment is important. Really requires somebody to do a deep dive with that child in terms of testing. Poor sleep, so sleep issues, both in terms of like a sleep disorder, like sleep apnea, as well as sleep problems, like kids that are going to bed too late or are waking up multiple times a night or are waking up too early and just not getting enough hours of sleep. That causes problems with attention, mood, impulse control. So while like some more mild sleep problems wouldn't be something that would cause symptoms as extreme as ADHD itself, a sleep disorder like sleep apnea actually can cause severe symptoms that very much mimic ADHD. So it's really important that an assessment kind of evaluates sleep patterns. And when looking at ADHD symptoms and treatment, poor sleep can exacerbate ADHD symptoms. So getting that under control is part of any good treatment plan for kids with ADHD. And then lastly, giftedness. So kids that are extremely bright may be bored in school, and so therefore they're not focused, they're not motivated, they're not paying attention, and that can mimic ADHD. It can also mask ADHD because they may be so bright that they, with minimal effort, can get very good grades, but they're struggling in other ways, and those kids are often more likely to get diagnosed later. So environmental influences are factors that aren't causal. They don't cause ADHD, but they can intensify symptoms. And so this is something that's important to know about. You may have a child that has mild ADHD, but these environmental influences or factors can turn mild ADHD into moderate or severe ADHD if they're not under control. So these are things like inconsistent routines, excessive screen time, limited physical activity, and nutritional gaps, either in terms of the quality of the diet, like making sure they're getting all the protein, vitamins, minerals that they need, but also the timing of meals, right? So if they are not eating kind of often enough or frequently hungry, that can really impact emotion regulation and focus. So that's also something to attend to. All right, now let's talk about what is involved in an ADHD evaluation, sort of what to expect, and why a comprehensive evaluation is often important. All right, so what should an evaluation include? So I'm going to talk about some of the nuances of this. I'm going to give you kind of the overview of everything that a comprehensive evaluation will include, and then also talk through kind of some, I guess, real world examples where people may not kind of do a comprehensive evaluation in kind of a as clear-cut a way as I'll talk about it here first. So a good evaluation doesn't just answer yes or no, like is there ADHD or not. It clarifies a child's strengths, their challenges, and points to the interventions that they need. one important point I think to remember is that medication is not the only treatment for ADHD. So it's not uncommon for people to think, well, I think my kid has ADHD, but I'm not going to put them on medication, so I'm not even going to bother to try and get them diagnosed, because what's the point? We're not going to treat it. But there's many intervention. Medication is actually a very good intervention for ADHD, but there are other interventions that can also be very helpful, both at home and in the classroom. So there's a lot that can be done through behavioral interventions, changes that get made at home, and behavioral interventions in the classroom. As kids get older, into middle school and high school, cognitive behavioral therapy, where you work directly with the preteen or teen on strategies for organization, managing thoughts and behaviors, can also be very effective. So a good evaluation is going to tell you what are the interventions that will be most helpful for your child, with medication and also not medication. The evaluation should include developmental history, starting from even before the child's born, all the way up through their current point in time. You know, when did they hit their developmental milestones? Socially, you know, how have they done in terms of friendships at school, any problems with peers, family dynamics, right? Developmental history all the way through. A medical history is also important. There are some medical conditions that can kind of mimic ADHD or exacerbate symptoms. So having that as part of the evaluation is important. A parent interview is key. It's an interview where the assessment will include symptoms of ADHD, ask kind of not just on a rating scale, but asking you to kind of clarify or describe what you might mean if you were to endorse something as occurring often or not often or sometimes on a rating scale. Like, what does that really mean regarding all the ADHD symptoms, but symptoms also of anxiety, depression, what we call, I don't like the term necessarily, but oppositional defiant disorder. So are they highly oppositional at home or at school, and what does that really look like? So going through and doing an interview about all of those things. If you have a preteen or a teen, then doing an interview with the child is also important to ask about some of those more, what we call internalizing symptoms, so symptoms of anxiety or depression. Sometimes kids, preteens and teens, are better reporters of those symptoms than their parents. So parents might say that their child is irritable and frustrating to be around. And then when you're talking to the teen or preteen, you get a bit more of like what their inner experience is like. And it may turn out that they actually have a low mood, really low motivation, and just kind of feeling really down, but it's coming off as irritability to parents. So talking to the preteens and teens as well is important. Getting input from teachers, often this is in the form of rating scales. It's not often practical for a provider to meet with the teacher or do an interview with the teacher or do a classroom observation. Sometimes that is involved, but often it's rating scales. And what, in my experience, you can get enough from rating scales to be able to have that cover that part of the assessment, as long as they're completed thoroughly. And then the last piece here is psychological or psychoed testing. Sometimes it's called neuropsych testing, and that's where you evaluate a child's kind of academic performance in a really standardized way to see where they are. Are they at grade level, below grade level, above grade level, in a host of different domains. And then also call it IQ testing, but really it's cognitive performance testing. So how they do with things like working memory, processing speed, etc. So that last piece, that psychoed testing, that's something that isn't 100% necessary to do an ADHD diagnosis. So a full comprehensive evaluation will have that, but you can diagnose ADHD without it. I would say that if the other aspects of the evaluation up to that point are suggesting that a learning disorder might be part of the picture, then the psychoed testing should definitely happen. But if there isn't too much of an indication that a learning disorder is part of the picture, then I would say that that piece is not essential. It can be helpful, you learn a lot from it, but it's not essential and can be costly to have it done privately. Right. So in terms of providers who can diagnose ADHD, your pediatrician is often the first point of contact for ADHD concerns, and pediatricians can diagnose ADHD. They won't do psychoed testing, of course, right? But they can get rating scales from parents, they can get rating scales from teachers. If it's a pediatrician you've seen for a long time, or you've been in the same practice for a long time, then they'll have access to that child's medical history, right? So they can review that on their own. They should still ask developmental questions, developmental history questions about things socially. But in terms of, key milestones or whether your child's kind of been on track developmentally, that will also be in their medical record as well. So they can do it, but they should definitely get rating scales from you and also from the teacher. They shouldn't just rely on like a single rating scale or your sort of description in a 10-minute appointment to say whether or not a child has ADHD. But if they can pull all these things together, then in cases that are not complicated, then they can diagnose ADHD. Child psychologists, so that's what I am. We can conduct comprehensive evaluations with or without the psychoed testing, and commonly diagnose or rule out ADHD. And psychiatrists who are medical doctors who specialize in mental health and can prescribe medication, they can also conduct assessments. Typically, psychiatrists don't do psychoed testing or neuropsych testing because that's not their specialty area, but they can do the rest and refer out for that. School psychologists cannot diagnose ADHD. So it's not within their kind of licensure to provide diagnoses for mental health conditions. But what they can do is they can conduct psychoed testing. So they can do that IQ assessment or working memory, processing speed, et cetera. And they can evaluate their academic performance using those standardized academic assessments. And if there's concerns about a possible learning disorder, then you can request a psychoed or learning disorder evaluation from the school. And then you can share the results from that with a clinical psychologist or your child's pediatrician or psychiatrist, and that they can use that for the psychoed portion of their evaluation. So some families split it up that way because the learning disorder assessment is covered by the cost. The cost of that is covered by the school, and school psychologists are well equipped to conduct that part of the assessment. It's just that the ADHD diagnosis, they might say that results of these rating scales or results of kind of our teacher or classroom evaluation suggest that ADHD might be present, but they can't make the actual diagnosis. But all the information and data and their input is highly valuable to whomever is doing the diagnostic assessment. All right, so let's talk here about when to seek professional help. So there isn't any sort of like firm guideline here. I think a lot of it is about trusting your instincts, right? You know your child best, and if something feels off, it's worth exploring. And I think if something has been going on for 6 months or longer, I would even say like 3 months, maybe, depending on the age of the child, because 3 months is a long time in a child's life, depending on their age. So concerns that last for 6 months or more, or 3 months or more, difficulties in multiple settings. So it's not just that they're kind of having a hard time staying organized at home, but there's problems at home, there's problems at school, there's problems with friends, like it's just showing up in a lot of places. There's a decline in their academic performance, or there's like this mismatch, right? Where you have this really bright child, but academically, their grades aren't reflecting that, or their performance at school isn't reflecting that at all. Or maybe they were doing well in school, but now it's getting up to like 4th grade, and all of a sudden things are going downhill and they're not getting the grades that they were before. I would also say if your child is seeming very frustrated at school, or you have a kid who used to like school, but now suddenly they don't anymore, and they're becoming really negative about school. Or if you find them speaking negatively about themselves, where you have a kid that was relatively confident before, but now gradually you're starting to hear them say more and more negative things about themselves, either because they're frustrated with themselves, or they're starting to internalize some of this negative talk that they've been hearing from teachers or parents at home, as you've been getting frustrated with them too, understandably. And then related to that, when friendships or family relationships are affected. So when you see more negative interactions at home in your family situation that involve your child, or with their friends, like if they're starting to be excluded or just kind of have friendship problems, things just aren't going well. Those are all indications that you should seek professional help and start working with someone to help get some answers about what's going on. All right. And now let's talk a little bit about what you can do right now. You don't need to wait for a diagnosis to start helping your child. Getting a diagnosis or ruling out ADHD and finding out that it's something else can take a while, right? It takes a while to get an appointment with someone. It takes a while for the evaluation itself to be completed, and you don't want to have to wait to do something. So what you can start doing right now is just documenting your child's behaviors. Like, keep notes on when difficult things are occurring. Like, when do the challenges occur? Is it like impossible to get out of the house in the morning without lots of yelling, lots of running around, lots of like shoving them out the door? Like, it's just a really hard time and a really hard way to start the day. Is it homework that's a really challenging time, or bedtime routines? Like, just make notes and document those things. How long do they last? What seems to help? What makes them worse? All of that can be really informative when you go to start to talk to somebody about your concerns with your child. I would also encourage you to talk to your child's teachers. You can ask the teacher for, like, what are their observations? What do they notice about your child? Are there any patterns they're picking up on, or areas where they really need to step in and help your child more so than other kids in the classroom? You should schedule a visit with your child's pediatrician to share your concerns. They're often the best kind of first step in an evaluation process, whether they do the evaluation themselves or they refer you to someone else. They're a good sounding board and a good person to start with. And then also, remember to support your child's strengths. Remind yourself of what they can do well and start praising them for those things. Start engaging with them around those things as much as possible, and try to avoid, kind of as much as possible, getting caught in these sort of like negative cycles that can happen, where you're in these interactions where frustration peaks, you get frustrated, they get frustrated, and things kind of spiral, which commonly happens. So find time to support their strengths, encourage them to do things related to their areas of strength, and engage with them around those activities and topics as well. And then there are some strategies that just help most kids, regardless of whether it's ADHD or something else, or maybe some symptoms of ADHD, but not enough to meet a diagnostic criteria. So having consistent routines at home, I often suggest that parents pick just one time of the day to start with. So if mornings are tough, work on implementing a morning routine, or if homework time is tough, start there. If it's just even the transition from home into whatever the next activity is after school, just work on that one tiny spot. Just starting small like that can make a big difference and start get you rolling. Having very clear expectations and sticking with them. Breaking big tasks down into smaller steps. So if you need your kid to go clean something up, rather than saying, hey, go clean up your room, you say, go pick up all the clothes off the floor and put them in the laundry basket, because maybe that's all that they can handle. But then they can follow through on that, and then you can praise them and ask them to do the next thing. So breaking those things down into smaller steps. As you're creating these routines and expectations, using visual reminders can be extremely helpful. And then kind of all those environmental factors we were talking about before. So focusing on having your kid get enough sleep, making sure they're eating well and eating often enough on a regular schedule, making sure they get enough daily physical activity, so at least 1 hour of physical activity a day, and setting strict limits on screen time, and especially no screens at least 60 minutes before bedtime, because that can really disrupt sleep. All those things are easier said than done, but if you can pick at least 1 or 2 of them to start with, that can just help you get the ball rolling. All right, so let's talk about some key takeaways, and then we'll be able to take some questions. So walking away from this today, it's important to remember that ADHD is just one of many possible explanations for attention and behavior challenges. And there's many conditions that can look like ADHD, which is why a thorough, comprehensive evaluation is essential. And this evaluation is going to guide the most effective and personalized support for your child. And I know we've got a range of ages, parents of kids with a range of ages here, today, but the earlier you can identify the root causes and start intervening, the greater the benefit there will be. But it's also never too late to start and to get a diagnosis or get clarity on some of these underlying causes. But starting to intervene, with or without a diagnosis, at least taking some of these steps can be really helpful. And I think the last point is just to, a reminder and acknowledgement that I don't think anybody who's wondering about whether their child has ADHD or not is looking for a label, right? You're not just trying to slap a label on this as if that's going to fix anything. What you're really looking to do is to find understanding, like understanding why your child is having the difficulties they have. And that's important because the better we understand the why, the better we can support the how or the what are we going to do now about it. Right? So that clarity is important, and having that clarity will help your child thrive.
Great.
So take questions, and thank you for your attention over the last 40 minutes or so, but questions are welcome.
Yes, no, there's a lot of great content, Dr. Ray. Thank you so much. And we do have a lot of questions coming in. So the first question that came in, I think this is a really excellent one because I've heard this. Every time I bring up ADHD, my husband says he can't have it. He can play Roblox for hours, and they're wondering, is that actually a valid point? But I've heard variations of that, and I'm wondering if you could provide some insight.
Yeah, that is probably one of the most common questions or variation on that comes up, and people will think, yes, they can't have my child can't have ADHD because they can focus like nobody else when it comes to video games. And sometimes, like I mentioned earlier, it's not just video games. Some other kids, it might even be reading, which is even more confusing for parents. But kids with ADHD can hyperfocus. It's actually part of it's not officially part of the diagnostic criteria, but it is part of like the diagnostic picture of kids with ADHD. And so whatever they're most interested in is where that hyperfocus tends to go. And so for some kids, that is video games. But also the way that video games are designed are specifically designed to like tap in to make it easy for you to attend, right? And they provide a level of stimulation that the ADHD brain almost craves and can respond to. It kind of gives you those like dopamine hits that you probably heard about. So for kids with ADHD, video games are almost even more compelling because it's a time where like their ADHD symptoms completely disappear, right? They are focused, it feels good, they're having a great time, they're not thinking about anything else, they're not stressed out, they're not anxious, and their brain is just completely dialed in. What you see as a challenge in kids with ADHD is that getting them off the video games, getting them to stop playing, we're seeing emotional dysregulation after they come off the video games is more prominent in kids with ADHD. So they have a harder time regulating their attention as they transition off of video games and back into real world. So if that's what you're seeing in your child, it may even be an indication that they're more likely to have ADHD if they can hyper-focus on video games. And there's a huge discrepancy between their ability to attend during video games and their ability to attend to all other activities. And if they struggle with transitioning off of video games back into like non-video related activities.
Mm-hmm. No, great. This question is interesting. I know a lot of people go out to try to get a diagnosis for different things, and because the school oftentimes needs this. But in this particular context, if we get a diagnosis, do we have to tell the school? And how do we protect our child from being unfairly labeled? And I think that's a really good question. And I was wondering if you could provide some insight on that.
Yeah, that's a big concern that a lot of parents have. I have certainly on multiple occasions had parents say to me like, okay, I don't want you to get teacher forms because I don't want parents to know, or the teachers to know that we're doing this evaluation, because I don't want them to know that we think my child might have ADHD. And I think that it's this fear of their child being labeled at school, and kind of being seen differently by teachers or treated differently. And two things, like in my experience of doing this for 15 years now or more, I just haven't seen that. Schools in general are very receptive, at least the teachers are very receptive, to their child, to parents working with them, saying, we got this diagnosis for my child, here's things we're working on at home, here's things that may be helpful at school, how can we collaborate on this? Teachers in schools are going to label your child, whether it's ADHD or not. So if you have a child that's inattentive at school or is having behavior challenges at school, especially on the behavior challenge front, they're going to unfortunately be labeled as a child who has behavior challenges, right?
Uh-huh.
And that's worse than having a label of saying this child has ADHD. Having a label of ADHD says this is a diagnosed medical condition and there's things we can do to help. Having a label of behavior problem just makes it like a problem that there's no solution to, and it's a much worse label to have. Or a kid who's inattentive or doesn't try or is lazy, for the inattentive kids, like the lazy one drives me nuts more than anything else.
Yeah.
Kids with ADHD work really hard. So it's kind of corrective in a way. Like, no, my child's not lazy, they have ADHD, and these are the things that we're doing to help them. And we want to collaborate you so you can help us too.
No, that makes great sense. It's always better to try to be proactive, right? And if you're right, I like that about the labels. I think that's really, because the schools, they're not going to know what to do. But if you have that diagnosis or you talk about that as an issue, that's going to give them a way to channel and focus the right kinds of services to help out. One parent was asking about being tested through the school, wanting to know how confident they should be with their findings. And I would imagine every school might be a little bit different in terms of the staff and how they go through that process. I mean, broadly speaking, is it okay, you think, for a parent just to rely on the school doing the testing for something like ADHD, or does a parent need to consider looking at a private option? I thought you might have touched on that a little bit earlier, but I just wanted to come back to that.
Yeah, no, that's a good question. So schools will do the psychoed testing piece when there's concerns about a learning disorder. So if they're not sure, they need to find out basically, like, does this child have a learning disorder, disability, reading, math, writing, whatever it might be. So then they're going to do the psychoed testing. If there's concerns about ADHD, but not big academic concerns, like they're not 2 years behind grade level or something like that, then the school will not do the testing. It's only when there's an academic learning concern, which for many kids with ADHD, there is. I mean, they may be 2 years behind, and not because they have a learning disability, but because their ADHD is so impairing. But they'll still do the testing to then rule out a learning disorder. And so when that testing is done by the school, there is some variability, but typically the results are valid. I mean, you never know if you're not the one who did the testing, right? But overall, I mean, I think you can trust the school's testing and test results. There are times, there's nuanced cases, I guess, around things like dyslexia and certain learning disorders where parents sometimes don't feel like the results are valid, or they need more in-depth testing to test more subtle, more specific deficits that sort of the broader psychoed testing didn't capture with the tests that were administered at the school. and then they seek some additional private testing. But broadly speaking, I think that you can trust the school's results. I don't think you need to be skeptical about it per se, and I think the quality is generally quite good. I mean, many of the school psychologists, this is what they do day in and day out, and they're highly trained to do it. So by and large, I think you can trust the school's testing protocols and their test results.
Mm-hmm. Good. And then as far as the testing, because we've had a couple of parents at different ends of with child learners or at different ends of the spectrum, right? Is it too late to have someone who, say, is 16 years old, and this is an example from one parent's question, struggled over the last few years completing tasks, leaving the house on time. I will say, just as from personal experience, right? My daughter, who does not have ADHD, had trouble getting out of the house on time to make the bus many times. But there is a concern here. Grades are similar, not living up to potential. Is it worth the time taking him in for an evaluation? What would you say about that? Someone who's 16, a high school junior, and is having these kinds of struggles, is it worth it to get them at least looked at and evaluated?
Yes, I would almost say it's more important to do a really comprehensive evaluation at that age, because it's one, it's trickier in some ways to make a diagnosis because there's all these other factors now that are kind of coming into play. The older you get, the kind of more conflating factors there are that sort of come in. And then in terms of testing, two things. One, it really helps answer some questions, right, about are there learning concerns going on here, or problems with working memory or processing speed that need to be considered. And then second, if you're thinking that your child is going to go on to college in a couple of years, if they want to have accommodations, academic accommodations in college, colleges will require that psychoed testing as part of many colleges will require that as part of like a evidence, basically, right, that your child has ADHD and qualifies for these learning support services that they have at the college level. So having that done now gives you information, helps you better understand the underlying causes, and then helps you set your child up for success in college, both in terms of interventions that you can start now, but also if they're going to qualify for any services at college, working with the Learning Support Services office and having those test results will kind of help accelerate that process.
Great. And I know we're getting close to the end. I do want to try to get in as many questions as possible. And then I knew you had some key takeaways, but I definitely want to come back to the key takeaways to see if there's some other ones that you might have thought of. But this question, there are a couple of questions from center staff from Huntington who are really kind of curious about, what can they do to best help ADHD or students who are on IEPs, right, in a center? How do we keep them engaged? How do we help them improve, during their sessions while they're in there? And I would imagine that this could also apply to parents too, to some degree, right? I mean, anybody who's spending time with a child who's helping them either with homework or learning in some capacity, what are some good tips and suggestions for kind of helping a student with ADHD manage their learning in the time that you have with them?
Yeah, that's a great question. So I think, one of the things that I love about Huntington's model is that you have these very small group formats, and sometimes one-on-one even, but it really gives them a level of individualized attention that they can't get at school. And for kids with ADHD, they thrive on that, right? Like just having that close proximity to an adult who's there with them, guiding them, even just sort of like being this sort of like parallel support person who's just even sitting there while they're working can be hugely helpful. But by kind of really structuring that time into small chunks, right? And laying out, just like I would say, have a routine at home. In a session at Huntington, having that session laid out into really small chunks, letting the student know right at the beginning, this is what we're going to be working through today, and then allowing them to sort of check off or give stars along the way to sort of give this visual image of the progress that's happening, and then providing lots of praise along the way. Praise is key in terms of keeping kids engaged and motivated when they have ADHD. And then little rewards, I think, along the way as well. And that can either be in the form of like, sending something home with parents saying like, hey, they got like 5 stars today. And then the parents can help, with rewarding that at home. Or if it's something that can happen at the center. And then for older kids, they can also, earn rewards even with their parents, whether that's like, time they can spend on, screen time or whatever it is. But really just that engagement, making sure that the student knows where they are sort of in the lesson, and then kind of praising them and kind of pulling them along in a way that doesn't allow it to feel too amorphous or never ending, and gives them a feeling of agency over their time as well.
Oh, that's excellent. Now, I know I mentioned doing some key takeaways, but you did provide them. And as I was looking through questions, there's a question, kind of a topic area that we hadn't really touched on. I think it would be a great way to close out the conversation tonight. And we've talked a lot about the kids, right? But the parents can get overwhelmed, right? This is a lot, and there's a lot of new strategies you have to learn. There's a lot, it can really try your patience working in that, with someone who's struggling, right? And it's your child. So what advice would you have for parents, or people looking for either support groups or just some tips of how they can kind of help navigate this and just sort of help them deal with sort of managing the overwhelming at times, feelings that can come up as they kind of do this work with their students or their children?
Yeah, it's hard, right? I mean, parenting is hard, period. And then when you layer ADHD on top of it, we often, in my psychologist world, we talk a lot about like parents of kids with ADHD having to be super parents, right? It's not just doing the normal, you have to do everything parents would normally do, and then you have to layer on top of that, all this extra stuff to help your child manage their attention, emotions, etc. And so having to take care of yourself along the way is really essential, in getting support for yourself. I think a place to start in terms of connecting with other parents going through something similar, there's an organization called CHADD, Children and Adults, I think, with ADHD, CHADD.org, and they actually have regional kind of offices, I guess, and they offer, I think most of them are online now, but support groups regionally for parents of kids with ADHD, also for adults who have ADHD themselves. Another piece of the picture is that, I mentioned ADHD is highly heritable, and so it's very common for at least one parent to also have ADHD themselves. So when someone like me says, oh, well, work on being more organized for your child, or, put routines in place, and it's like, well, that's really hard because it's hard for me to do that myself. So working with a psychologist for yourself to kind of help both figure out strategies to kind of help process, first of all, like everything that you're dealing with your child and in your family relationships. And then also just some strategies to partner with someone on how do you sort of help structure things a bit more, or create some additional organization at home, so you don't have to feel like you're doing it all yourself, because it can be overwhelming. And then lastly, just starting small. Like I said, I think starting with one small thing can make a big difference. And then you do another small thing and another small thing, and gradually over time, you start to see some big changes.
Yes, I think that's a great tip. I think that's true for a lot of things in life. We always, if you do too much at the start, feeling that you've got to boil that ocean, what happens is you crash and burn, and then it just doesn't work out, right? So definitely keep things manageable. Dr. Ray, this has been absolutely phenomenal. I want to say thank you so much for spending the time with us, and I know that there are a handful of other questions we didn't get to, but we'll certainly provide, if you've asked a question and you didn't get an answer, we'll provide that to Dr. Ray and our team here at Huntington to see if they can follow up with you directly. And of course, we have recorded this event. I apologize for the snafu at the beginning, but we'll make sure that the slides are displayed in the on-demand, so you can see that, and you're not going to miss any content. And of course, if you have any questions, please do not hesitate to reach out to our team, 1-800-CAN-LEARN, or just go to the website, huntingtonhelps.com. we are here to help you. So Dr. Rooney, thank you.
All right, thank you very much, Michael.
Yeah, absolutely. And thank you for everyone who's attended. This concludes our presentation today. And again, we'll make this available to everybody in the next couple of days. And if you have questions, please reach out to us, 1-800-CAN-LEARN or huntingtonhelps.com. We look forward to seeing you at the next event. Take care, everybody. Stay well.
Bye-bye.